Hello, everybody. It is Celeste Williams, the Democratic candidate for U.S. Congress here in Arkansas's 3rd Congressional District. And off camera is my communications director, Stephanie Baker. And we'll get started here in just a moment. You won't see her because we are practicing social distancing right now.
I'm over here, 6 feet away. And if anybody has trouble hearing me or hearing Celeste, please type in the comments and let us know.
So as we get people on here, we'll go ahead and get started. And we'll start with questions.
Why don't we go ahead and start with Celeste? Just introduce yourself.
Mm-hmm.
Tell us a little bit about where you're from, your background, and why you're running.
Okay. So I grew up in very rural Gultree, Oklahoma. My dad is a Vietnam veteran and worked in the oil and natural gas industry. My mom is an artist, and I am formerly a foster parent. I am a family nurse practitioner, and I am running for Congress because every day in my practice I see people who are struggling with the cost of health care, and I think that these are things that this is something that needs to be fixed outside of the exam room. I want to make sure that we have a world where people can get the care that they need regardless of financial means, that we have a world-class education system, and that we pay people fair wages for the work that they do.
Can you tell us a little bit more about your educational background?
Yeah.
Specifically your time nursing and as a nursing educator.
So like I said, I'm a family nurse practitioner. I graduated from UAMS. My undergraduate was at Southern Nazarene University, and I did some adjunct teaching. I taught critical care for the University of Arkansas for a short period of time, and I was the critical care educator at Washington Regional. And I've been doing family practice for about 10 years now.
Can you tell me a little bit about your family life now, your everyday life?
So I am the mom to 4 beautiful little children. I have a husband named Kirk who is an ER nurse. We are sort of a blended family in that I have 2 biological children, and we adopted our foster kids.
Thanks. So we had put out notice that we were going to be doing this virtual town hall ahead of time. So we had a few people email us questions ahead of time. So I'm going to ask you a few of those. One question came in about services for working families, and they were curious about how we would pay for those services. Can you address that?
Sure. So when I think of services for families, I think that all families do better if they have financial means. And so one thing that we need to do is make sure that everyone has access to health care, and that people are working and making money from jobs that pay a fair wage. So you pay for these things by having fair taxation. Everyone needs to pay their fair share to invest in the common good. So my example that I come back to over and over again is that Amazon pays $0 in federal income taxes. That same company is using workers or hires workers who were educated by our public education system. They are using our roads that we all as taxpayers are paying for. And so they too need to pay their fair share. And so if people are paid a fair wage, then they do not need to rely upon the public safety net. I think that everyone wants an opportunity. People don't want a handout. They want an opportunity to be self-reliant.
Another question that was emailed to us was about the upcoming census.
Mm-hmm.
Can you address the importance of why people should participate in that?
So we all need to be participating in the census. That is how our municipalities are funded. If they don't know the number of people who live in the community, then invariably those communities are going to be underfunded and not as able to meet the needs of the community.
Another question that came in was from someone in our community who is concerned about discrimination against LGBTQ plus Americans.
Mm-hmm.
Specifically, as a nurse, she wanted to know how you feel about the Trump administration's position that healthcare providers should be allowed to turn away transgender patients on religious grounds. And she wanted to know how you would fight to ensure equality for folks that you will represent.
So I think all people need to be able to get the care they need. And it is certainly important that we protect, America has always valued personal liberty, individual liberties and freedom. And so each person needs to be able to live the life that they want to live. We don't need to legislate what people do in their personal lives. What we do need to do is make sure that we have federal protection for everyone to be able to get a job, live wherever they want to live, and include health care in that, and not be discriminated against.
Okay, in a similar vein, another person emailed concerning underrepresented groups and concerned that there's a statistic that 1 in 5 members of the LGBTQ plus community are not registered to vote. And in light of coronavirus and us being unable to go out into the community, how do you propose we can reach folks for voter registration efforts if we can't go out into the community?
So I think we need to partner with groups in the communities. So we would love to do some phone banking to help reach anybody who is not registered to vote. We all have a stake in our community and our country. And the one thing that we can do to make a difference is to vote. And so we need to make sure that everyone is registered to vote so that we can pressure our representatives to actually represent us.
Okay, another question that came in that I'm sure is on a lot of people's mind is, how prepared do you feel that our local hospitals are for what may be coming ahead with the COVID-19 outbreak?
So I think we all need to be concerned about the COVID-19 pandemic. Do I think that we are prepared? I think that we are as prepared as we possibly can be. I think that it is difficult to have the amount of preparation needed when we aren't sure what the actual numbers are because we have not had testing available. I think that we need to empower the federal government to help bring the resources that are needed. We need to think about how do we rapidly expand the number of ICU beds available within the community when and if our healthcare systems are overwhelmed by the number of people who will be critically ill. The other thing that we need to keep in mind is that as the virus spreads, healthcare workers are going to be infected, and making sure that we have a plan in place of how do we deal with that. Whether it is we need to make sure that we have community testing available. So that's something that we need to be pressuring the federal government, state, and local agencies to increase the amount of testing. Part of the holdup has been that those tests just really have not been available. Did I answer all of that?
I believe so.
Okay.
I want to go ahead and remind everyone that's viewing that if you do have a question for Celeste, you can go ahead and put it in the comments, and we will try to get to as many questions as we can. So just go ahead and put it in the comments, and we have folks here 6 feet apart from each other that are monitoring those questions, and we'll try to get to those.
I would like to also just say that, you know, we all know that the disease spreads and the increase in number of cases is exponential. And we all have to do our part to come together and help reduce the spread of this illness. You know, this is not a partisan issue. Every single person in this country has the ability to do their part to help reduce the spread. And we do that by staying home, by social distancing, and making sure that we are getting tested if we have symptoms so that we can best determine how we can track everybody around us and really quarantine.
Another question, I believe COVID-19 is going to be a popular topic tonight. Another question came in and wanted to know what you think the government can be doing better or should have done better in response to coronavirus.
So I think there's going to be plenty of time to review and figure out what we did wrong. I think moving forward, what we have to do is focus on how do we reduce the risk to those in our community. I think we have to think about activating the Army Corps of Engineers to help us ramp up our hospital capacity, and that may be tent type hospitals outside, because like I said, this really is going to increase, which sounds very alarmist, but that's just the math of this disease. I also think that this is a problem that highlights the weaknesses in the financial stability of Americans. Almost half of Americans do not have more than $400 in their savings. And I think that it is imperative that we get families the money that they need right now. Because right now, so many people, if they lose their job, are really in a precarious place to be able to support and provide for themselves and their families.
Another question that came in was, what concerns you the most about coronavirus?
So the things that worry me about coronavirus are that there is no vaccine right now. We do not have any antivirals to treat this vaccine or this illness. And so it is truly prevention that we have right now, and then supportive care for those who get this infection. And what I find most concerning is that hospital work and healthcare workers, we're on the front lines. And as healthcare workers get sick, who is going to care for those who become sick within the community? And so that is really one of my greatest concerns. And so, oftentimes, if you have a fever and you do not have respiratory problems, what you need to do is stay home. There's nothing that we can do for you. There's no prescription that we can give you. It is staying home, taking Tylenol, and not exposing others to the illness.
Another person has just commented and asked, what legislation do you see as a priority for Democrats as they control Congress?
I am always going to be one who wants to make sure that everyone has access to health care. I think we have to have a public option so that everyone, regardless of income, can get the care that they need. We have to use the federal government to negotiate for lower drug prices and make sure that people are able to get health care. Sick people cannot work. It is a basic human right.
What can you do in Congress to prepare Arkansas for climate change?
What can I do to prepare for climate change? Well, I think that we need to make sure that we are that we have a revenue neutral carbon tax. I think we also are going to have to invest in recapturing CO2. I think that we have to stop subsidizing the fossil fuel industry, and that we have to invest in green energy.
Can you talk a little bit about teacher pay and funding for IDEA?
So there was legislation that passed through the House to fully fund IDEA, which helps fund any kind of kids with special needs or healthcare needs, any of those kind of things. And it's never been properly funded. Public schools were charged to educate all children. They don't get to cherry pick which students they are teaching. And we have to make sure that schools have the financial resources they need to give all children the best opportunity that they can have. Certainly being quarantined at home with my kids not in school, I absolutely say that teachers are horribly underpaid, and I think we all knew that, but it certainly reinforces it when you're trapped at home with 4 kids.
Okay, so this question is interesting, and I don't know if you'll know the answer to this. Do you know if coronavirus is killed in municipal water systems?
I don't know if we have an answer to that. One would assume, which I know what they say about assuming, but one would assume that the chlorine that is used to treat our water would kill that virus. It certainly can live on surfaces. I know there was a study that came out recently that showed that on like a stainless steel countertop, the virus can live for up to 3 days and about 24 hours on cardboard. There's a lot about this virus that we don't know. And so, the amount of information that we have out there changes rapidly as we learn and get new information.
Another question that came in is, how do we make sure that direct support of families because of this virus doesn't just become a single Band-Aid, but becomes a change in the system?
So I always think of a children's book that I read to my son that talks about every problem contains an opportunity within it. And so I think that with an enormous public health crisis in this COVID-19 pandemic that has highlighted the weaknesses in our public health being unprepared, and we haven't invested in that to the extent that we should, and in our financial weaknesses, that it is an opportunity to better invest in families and individuals to make sure that they have the ability to have a financially stable life. And I think the way that you get there is having fair pay for work. It is making sure that everyone has access to health care, that we have a wonderful public education system, and that higher education and job training is affordable.
Can you tell me what you think about the stimulus package?
I think it is desperately needed. I do not want to see a large corporate bailout, but I think that if you give people money, they will spend it on the things that they need, which then stimulates our economy.
And I want to go back to earlier when I asked you about an email supporting equality for the LGBTQ community, that the person who asked that question wanted me to clarify, will you support the Equality Act?
Yes, yes, I would definitely support that.
She just wanted clarification
yes,
on that.
I apologize if that was not, I did not state that clearly.
Okay, let's see. I am trying to get through all of your questions, guys. You guys are doing great. Thank you so much. So this question, I think you kind of addressed your point of view on paying Americans as an economic stimulation.
What about that point?
What is your point of view?
That's what we need to be doing.
Yeah. Okay. Thank you. I just wanted to clarify because that was a specific question. This question says, since toilet paper is so hard to get right now, this is a hot topic, have you heard from manufacturers when supplies will be arriving in the stores?
So I won't say that I've heard from them directly, but I was reading an article recently that 90% of the toilet paper used in this country is manufactured within the United States, and that local stores and businesses believe that they will have the shelves stocked again within the week. So,
okay.
Stop buying it and hoarding it if you have some already. Let everybody else get theirs.
How do you see federal actions consolidating, and how do we expand efforts to lower food insecurity?
How do we expand efforts to lower food insecurity? So, one, we have to make sure that people are being paid a fair wage so that they have the money that they need to support themselves and their families. The other group of people the two groups of people that are most affected by food insecurity are children and our seniors. And so we need to, one, make sure that the children's parents have a good paying job. Not that we're giving away those jobs, but we make sure that people are being paid a fair wage so that they can put food on the table to support their families. And then with our seniors, we need to make sure that their Social Security is keeping up with the cost of living, which, there's some debate as to if we're figuring that out properly, and they do need an adjustment for the cost of living.
Okay, another question is about your thoughts on the opioid crisis and how we can work to contain it.
So one of the things that has been done that I see that has really helped reduce or helped address the opioid crisis is that now when healthcare providers write a prescription for an opioid, they are required to check a database that tells them how many prescriptions this person has filled. So if I write someone a prescription, then I log onto the state database, and it's also linked with other states. So it's not just Arkansas that I can see where they've been getting, who they're getting prescriptions from, how many pills they're being given. And so I think knowledge is power, and having a better understanding of how many pills a person is receiving helps you then have some real conversations with that person. And also we have a better understanding of pain management as well. Opioids are not always the answer for chronic pain. And so I will say that I think that is getting better. I would say that it is very lacking in treatment facilities and getting people in to get the addiction treatment and services that they need. We do not have the resources that are needed in the community for addiction, and I would also add for mental health care as well.
Do you have any concrete ideas on public transportation systems in the 3rd district? More buses, connecting light rail, more density housing, etc.
I think we need to have a regional approach, which we do have a regional transit system, but I think we need to have a good broad plan and making sure that we are really hearing from all stakeholders and people who use public transit. What do they need? How would they be better served? Making sure that, for example, that the bus system would stop at the food pantry, and those types of things. I think long term we need to kind of look and figure out, is bus the most appropriate way to move people from point A to point B? Do we need, certainly building a rail system is expensive, but in the long run, does that really benefit our community and help support a good public transit system? So it's really, I think we need to do a better job of talking to people who use it in the community. And maybe more people would use it if it were friendlier and easier to access.
This question kind of goes back to the coronavirus pandemic. What would you recommend to someone who is employed by a private organization that is not observing safe distancing or precautions for hourly and salaried workers?
So I think that's really hard to put people in these situations. That's why paid time off and paid medical leave is so important, because a lot of people who feel financially insecure, they're not going to stay home because they don't know if they do, they don't know how they're going to put food on the table. And so I think that it is very important that we close businesses who are unable to do that. Because while I understand financially it's important for you to be able to go to work and for those companies to continue to produce their product, more people will die if we do not take these drastic measures and stay home. Because the way this disease is passed is that, you have to have a vector. So human beings are excellent little vectors of disease. And especially when you have some cases in which you have very mild symptoms or you don't really feel like you are sick, those people aren't staying home, yet they're still shedding that virus and passing it on. And so this is a public health crisis in the making. This is a public safety issue, and we all have to do our part, and we all have to stay home and not spread this virus.
Okay, this question is switching gears. Explain your position on gun ownership.
My position on gun ownership. So I think I'll just start with the basic that I support the Second Amendment. If you are a law-abiding citizen, I don't care if you have guns. I will say, as a family nurse practitioner, I do always ask my patients about safe storage, just because I think it is important for everybody to be responsible and safe with their guns. I do think that if you are someone who is a domestic abuser, if you are threatening to harm others with your gun, then it should be taken away from you. And I think sometimes we also then forget about, not just gun violence as it's suicide is part of that, is what I'm trying to say. If someone is threatening to harm themselves, then for their safety as well, then, I do support extreme risk laws where we can take that out of their hands and get them the help that they need to protect both themselves as an individual and the public if they're threatening others.
Since you deal with medical insurance as a provider, what direction do you think we should move with healthcare plans for all Americans?
So as I said earlier, I absolutely support an affordable public option. I think we also need to automatically enroll children so that we make sure that people are able to get the care that they need. I don't want to subsidize private health insurance. I want to make sure that we are investing in a healthcare system that moves towards Medicare for all, but I want to make sure that we're doing that in a responsible manner. There are approximately 3.2 million people who are currently employed in the private health insurance industry, and I don't want to see all of those people lose their jobs like overnight. We need to transition towards a sustainable way to pay for the care that people need. We're paying as a country, in some instances, 3 times as much of other countries, and you would think that with spending that much money on health care that we would have amazing outcomes, and we are not. We have people have a declining, what's the word I'm looking for? So their life expectancy is declining, and we need to make sure that we are really investing in preventative health care, which would help bring the cost of health care down, and make sure that we're really doing a better job managing chronic illnesses. And specifically, we spend about 80% of our healthcare dollars on 5% of our population, and making sure that we're really addressing the needs of those people so that we are spending our healthcare dollars in a better way.
How can we help rural communities with declining populations create jobs or opportunities when taxes are declining?
When taxes are declining. I'll just speak to rural communities. I grew up in a very small community. Like I said, I graduated with 19 people. We had a Class C football team, very small community. And I, like many, left that community because there were not job opportunities there for me. And so I think that we have to make sure that we have a structure in place where maybe it should be easier to get a small business loan in that community. So it should be easier to get a loan for a taco truck than it is to incur $100,000 in student loans. And making sure that there are job opportunities, such as making sure, everywhere we need plumbers, we need electricians, and making sure that the training that you can get for that is affordable and that people can then work in the communities where their families are.
So I've often heard you say mental health care is health care. We have a question here about how to add mental health infrastructure. Would it be more providers? What kind? And how would that be introduced to the public?
So one of my ideas is that we need to integrate mental health care into primary care. So we need to make sure that, let's say that I, as a primary care provider, see a patient in clinic who I have done a workup, and their problems are not necessarily due to a physical problem, or maybe they've come in and said, I'm really struggling with anxiety and depression, whatever the case may be. It is a barrier for me to say, okay, I think you need to go see a counselor. And then I send them home with a phone number and tell them to call and make that appointment. Well, sometimes they talk themselves out of making that phone call, or it's just too complicated, or they feel overwhelmed by the process. And so if we had a social worker or a mental health professional within the facility, I could say, you know what, I see that you're struggling with this right now. Let's get you the care that you need. And you could then introduce that person and allow them to visit with that person, come up with a plan, and then schedule a follow-up appointment and come back to the exact same building, where you're then also reducing the stigma of getting mental health care, because it's in the same building. Nobody needs, if you want people to know what kind of care you're getting, great, you can tell them, but you're just showing up at your primary care provider's facility and able to get the care that you need. So then I also think about like rural communities. I think we may need to help incentivize providers to work in those areas, mental health workers to work in those areas. And then also maybe we need to invest, let me rephrase that. We do need to invest in like telehealth as well. I always favor an in-person conversation, but the second best thing would be talking to a professional through telehealth.
In that same vein, I have another question here. How do we make sure Arkansas veterans have access to the mental health care they need?
So I would say that the VA system actually does a pretty good job with mental health services. They also are able to get care that they need outside of the VA system if they are asked to wait for a long time for an appointment. That said, in primary care, for the average non-veteran citizen, if I put in a referral for someone to see a psychiatrist, I am often told that they cannot get in for 9 months. And so the VA is actually doing a much better job of getting people in a timely fashion than the public sector is right now.
Would you support mental health being in healthcare reform?
Absolutely. Mental health is healthcare. Like, it just needs to be integrated to where it is the same thing, just like I talked about a few moments ago.
Do you believe that our region should use tax incentives to draw business to this area?
Yes. I think that, actually I would say business tends to bring in more business. I think we also need to think about how do we invest in rural communities who are being left behind. Businesses are coming to Northwest Arkansas all the time, but other areas within the district, like Fort Smith, do not have that same rapid growth in the business community that we are seeing here in the northwest corner of the state. And so I guess I will say that we need to make sure that we're investing in underserved areas as well so that they have the opportunities to succeed in that community as well.
As a House member, you will have a voice in foreign policy.
Yes.
Do you support ending the war in Afghanistan?
Yes, I think we need to, in a very responsible way, get out of that region, but it has to be with a tremendous amount of planning and make sure that that region is not left unstable with a rapid withdrawal.
Should we have a health corps?
A health corps?
That's what the question asks. I'm not sure.
I don't know what a health corps is.
That the person who asked that question, if you want to expand on that, let us know. We also had a question that came in via Messenger, going back to your opinion about gun policy. What is your opinion on the boyfriend loophole? The existing, as you know, domestic abuse legislation does not address boyfriends.
The boyfriend loophole needs to be closed. It needs to make sure that anybody who's committing domestic violence is not allowed to have a gun. They've already proven that they are not making safe decisions and have violent behavior.
We have another question asking if pets can get COVID-19.
I believe that there was recently information released that said dogs cannot get it. So generally, viruses are not passed on from one species to another. And to my knowledge, that is not something that we're seeing.
We have until 6:45, so I'm going to ask a couple more questions, and then we'll close. If anybody has any more questions, make sure you put them in the comments here for us. We just had another one come through that says, upper education tuition is so expensive. Do you have plans to address this?
Higher education? Yes. So part of the problem that we see now is that state and federal government has really divested from properly funding colleges and universities. And so we need to increase that funding so that students are not then left bearing all of the weight of funding colleges and universities. And, you know, I realize that not every single person is going to use the higher education system, but we all benefit from it. You know, nurses, physicians, lawyers, teachers, all of the people that help create a more stable society. We all benefit when we have highly trained, highly educated people in our community.
Okay, clarifying that health corps question,
Mm-hmm.
he says that it's kind of like a Teach for America program. It's a rural health entry for health providers.
Yes, so there actually is incentive. So like if a physician goes to medical school and they will agree to work in a rural community for so many years, then their student loans will be forgiven or repaid. And so I want to see that continue. I would even encourage more of that, and also include, you know, nurses are, I believe, included in that. I would also like to see mental health care workers included in that. And I think that really does help those rural and underserved communities. And I would actually add underserved communities as well to that funding. A lot of times we think of just rural communities, but there are also other areas that are just underserved because of poverty.
Okay, so last couple questions. I would like you to address a few more questions about the coronavirus pandemic.
Mm-hmm.
What should people over 65 be doing?
People over 65 need to stay home. You need to wash your hands frequently. You need to avoid touching your face. You need to sanitize high-touch surfaces such as doorknobs, light switches, things like that, and really need to stay home. You do not need to be out in the community getting exposed, and that will also include for my parents, and I am not allowing my children to come visit them right now.
My last question for you is, why should the people of District 3 elect a nurse?
Well, I think that it is really, actually, I'm going to back up a little bit. So I'm going to talk a bit about why I think that I can do this job. So a couple of years ago, I attended a Lobby on the Hill day with the American Nurses Association. And on that day, I had the opportunity to have a discussion with our current representatives and legislators and senators. And it was really during those discussions that I realized that I have a much better understanding of the consequences of bad healthcare policy, and a deeper understanding of I had better solutions than they did. And every single human being is going to require healthcare at some point. And it is so hard to practice and see people that took time off from work, that come in to see me and get a prescription for their problem, and they can't afford to fill that prescription. 1/3 of all prescriptions written are not filled because of cost. And I think that that is wrong. So I think that I have a deeper sense of what average Americans are facing than our current elected officials. And I think that we need to have a representative who truly represents the district and is really willing to fight for the families and individuals in our district and make sure that they have the opportunities that they need in order to succeed. And we certainly are seeing right now the cost of not investing in a public health system that can rapidly respond to any looming threats. So I appreciate each and every one of you, and thank you so much for joining, and hopefully we can do this again soon. Be careful out there, wash your hands, stay home.